Hello students, in this video, you will listen to the different SEQs in general surgery. SEQ. 6. To reduce the infection rate in operation theater, the Hospital Infection Control Committee has given 6-point instructions for all to observe. Please reproduce them here. Answers. Proper scrubbing. Proper gowning and gloving. Reduce inappropriate movement in theater and reduce too many people in the theater. Reduce contaminations of instruments by unscrubbed persons. Ventilatory system should be laminar airflow. Proper skin preparation. Proper draping. Follow the universal precaution. SEQ. 7. A 35-year-old school teacher comes to the surgical outpatient department with a uniform swelling of 6 by 6 centimeters in front of the neck. She has prominent eyes. Her pulse is 120 per minute. She is not using any medications. A. Enumerate the clinical tests to complete your evaluation. B. Enlist the investigations in order of priority. C. Give immediate management in a maximum of 6 lines. Answers. A. Inspection of swelling, palpation of swelling, percussion and auscultation. Eye signs, pulse, tremor, reflexes. B. Thyroid function test, thyroid antibodies, thyroid scanned. C. Tab propranolol. Tab neomercazole. Lugol's iodine. SEQ. 8. A 12-year-old schoolboy comes with a bluish swelling 2 by 2 centimeters in size, lifting his tongue upward and on the left side. On examination, it feels soft. A. What is your likely diagnosis with closet differential diagnosis with some points? B. How will you treat this case? Key 8. A. Ranula. Differential diagnosis is a hemangioma, or lymphangioma, undersurface of the tongue, as both are cystic and compressible, sublingual dermoid cyst, mucus retention cyst, tumor of the sublingual gland is firm in consistency. B. Excision of the sublingual gland or marsupialization of the swelling. SEQ.9. A 35-year-old shopkeeper's presence with a discharging point on his right cheek. A. What will be essential clinical examination in this case? B. How will you proceed with the most appropriate treatment? Answers. A. The clinical examination consists of inspection, number, position, opening of sinus or fistula, discharge and surrounding skin, palpation, tenderness, wall of sinus, mobility and lump, examination with probe and examination of the oral cavity and draining lymph nodes. B. First confirm the diagnosis by relevant investigation, cytology and culture of discharge, sinogram or fistulogram, MRI treatment according to the diagnosis, osteomyelitis, parotid fistula, actinomycosis, sebaceous cyst, and tuberculosis sinus. SEQ.10. A 13-year-old schoolboy brought up after a highway traffic accident 3 hours ago. He bears an abrasion and bruise on the right upper quadrant of the abdomen. He has a pulse of 100 per minute and blood pressure of 100/60 mmHg, and complains of pain in his abdomen. He narrates the whole story of the accident. A. What will you immediately do? B. What will be your next step? C. Outline the subsequent management plan. Primary survey and resuscitation consist of assessment of the airway with control of the airway. Assessment of breathing and maintenance of circulation with crystalloid fluid, appropriate analgesia, antibiotics and tetanus toxoid. Intake and output charting by indwelling Foley's catheter. A secondary survey and thorough examination of the abdomen. The next step is, if the patient vitally stable, then request for relevant investigations, USG abdomen, radiograph chest and abdomen, CT scan if needed, baseline investigations, screened cross-matched blood. Management plan is according to the status of patient. Monitoring of the vital sign, pulse, temperature, respiratory rate, blood pressure, measurement of abdominal girth half an hour LY, serial examinations of abdomen 4. Increasing tenderness or guarding or absence of bowel sounds and any signs of internal bleeding, keep nil per oral, pass nasogastric tube for aspiration and Foley's catheter 4. Urine output, intravenous fluids, analgesia, and antibiotics. Local management of abrasion. If response to conservative treatment, then continues the treatment. If deterioration occurs, then surgical intervention in the form of exploratory laparotomy is needed.